morning.
11 years ago, I created the foremost center for limb lengthening and limb reconstruction here in UAE, and I bring this center now to Feital Hospital. What does it mean, limb lengthening and limb reconstruction? Whenever there is a problem of the bone, either if it is too short, or it's bent, or it's crooked, this can be corrected in the way that the bone has to be cut and has to be stabilized outside with the external fixator or inside with special tools. And then it has to be waited for a couple of days until the bone wants to heal. And then you can do destruction. Destruction means you can lengthen the bone. I brought you here example. This is a Elisaro fixator. Here is a defect of the bone inside, and this can be compensated with the own bone. The cut of the bone is at this area, and with internal cables and destructors, the cables lead over these pulleys to these destructors, and when you turn these destructors, the bone will come internally and do the lengthening, and step by step it will fill the gap. And this part here will be organized by the own body with the own bone, complete good quality. This technique is called, because I have invented it, Weber cable technique for internal bone transport. This can be used, these techniques and this external fixation where wires from outside to inside are fixating the bones. In order to do all these manipulations, the bones can be straightened, defect can be filled, and you can do lengthening. The speciality of this ring fixator is that it can be used in newborns or in little children. I was the first to use this mini fixator in Europe, and it's working very well. Other tool is this one here. It has the possibility to correct all deformities, but you need for this a computer and a special software program to make the accounting of all the different measurement steps you need. Another very interesting tool is this one. While all these are external fixators, have to be mounted on the leg from outside to inside. This one is completely put inside of the bone. It will be fixed here with small holes to the bone, and it has a magnetic system inside and a gearbox. So when you implant this inside, you have to cut the bone. The principles are all the same. Then you can activate the magnet here inside with a magnet you apply from outside, and when this magnet is turning, this telescope will come out and you can do the lengthening internally. Beside these tools, there are a lot of other techniques required to reconstruct the limb. I have developed over 40 proprietary unique techniques to improve the functions of the limbs of the children and the adults, and to prevent amputation. If you have any problems with your limb, with your legs, with your foot, with your arms or with your hands, I can help you.